Hello, everyone. My name is Matthew Holbrook, and for this interview, I will be interviewing Emily. She goes by the pronouns she, her, and we are going to be discussing her um, diagnosis and her treatment journey with pheochromocytoma. Um, and it's a pretty long interview, so I am going to be cutting it up a little bit. And unfortunately, the end of the video did get cut off um, because the recording went over Zoom's limit of an hour. But we did eventually end it off, and she had a great time interviewing, and she's a lovely person. And I hope you enjoy the rest of the interview. Thank you. Just a little bit about me. I am a college student. I am 19 years old. I'm studying at Consumidus River College. I'm doing 2 degrees for biology and nursing. And that's a little bit about me. Was there anything that you want to tell me about you first?
What's your name?
Matthew. Sorry, Matthew
Matthew.
Holbrook. Yeah.
Hi. My name's Emily, and I don't know do you want my last name or do you need
No,
my
you
last
don't have to. No,
just
Emily's fine. Yeah.
right, I'm 54. Like, I mean, my first symptoms were, well, do you want me to go into the whole story, or do you want to know just some
Yeah,
basic stuff?
absolutely. Yeah.
Okay. Um, so I should also mention two other things that are interesting. One is that I had long COVID for about a year
Mm.
in, I think it was 2021 to 2022, if I remember right. And it was like headaches and, nerve eh,
Yeah.
damage,
Yeah.
and like pain and, brain fog and stuff like that, like aphasia. And
Mm-hmm.
I was working at Yale University, so
Oh, wow.
yeah.
Yeah, that's stressful, I'm sure.
It was, but like it's also great because there are tons of doctors and like hospitals there. So there's a whole long COVID clinic that started up there, and they were really helpful in
Mm-hmm.
helping me like can, get the headaches and stuff under control. But what's weird is that I'm having some of the same symptoms during the Pheo spells. So
Mm-hmm.
it's who
It gets
knows?
confusing which one's
I
which.
mean, another sort of medical oddity is that about 10 years ago, I had something called a Takotsubo cardiomyopathy, which is
Oh, wow.
broken heart syndrome. So
Mm-hmm.
that is an overload
Just
of
stress factors.
stress vectors also. I didn't even think about this. I've always thought that I didn't think they were related, but when I watched, the Para advocacy website and research website,
No, no, I don't know about
oh,
that.
you should definitely dive into that.
Okay, yeah, I will.
I think it's pheopara.org, but
You let me write that down.
yeah. Um, it's good. And anyway, I was looking at their animation on, you know, their sort of helpful explainer, and there were various people who posted the comments. I had a reverse Takotsubo, you know, and it turns out it was this or caused this or it's linked to this. So it
Mm-hmm.
seems to me like there's a lot that hasn't been answered yet about
Yeah,
all these
our bodies are
connections.
mysteries.
Especially COVID. I mean, I think it awakens a lot in people where it can trigger new things, or it's a thing unto itself. It's like
I
yeah,
feel like everyone reacts to it differently. I've
they
gotten
do.
it 3 times, and
Yeah,
and thankfully every time I was fine. But I also know individuals that they got it and unfortunately did have more adverse health effects as a
yeah.
result. Permanent lung damage, for example. So I
Well,
do.
I would
It's just
definitely
so.
mask in any kind of like
Yeah.
healthcare setting or an airport and things like that, just to be smart and
Yeah,
try
that's
to get
good.
your family members to still be
Prevent it.
reducing it as much as
Yeah.
possible, right?
Herd immunity, right? So
Exactly.
try to reach that eventually. Yeah. Yeah, I agree.
Exactly. So I moved out here, and then this job was really stressful. I just, everything was getting more stressful. And ultimately, I just really couldn't work anymore. Like
Hmm.
I've never had this, I've always worked, since I was in college. I just would like overload, just like flood with stress.
Yeah.
I mean, it's true. I was also in a really, really stressful job. So
Hmm.
there's that. But
Just
like,
pile it on.
yeah, it was just this stacking thing that happened, and I did a bunch of stuff. I took medical leave. I went to all kinds of like anxiety classes, and I've
Hmm.
already take, anxiety medication, and nothing really seemed to make that much of a difference.
Right.
And then I got back from my leave, and then they had like a layoff of a bunch of people, so I was in that group, which was annoying. And then
Mhm.
that now I had that stress to deal with. Meanwhile, over the past this whole 3 years, I'd been mentioning it to doctors. And here's the thing that you have probably gleaned by now, or maybe you know already, is
Yeah.
that especially women in middle age are just kind of like, whoa, what are you gonna do? You just,
Yeah. Probably
who
just your
knows?
period. You're on your
It's probably
hormones out of the way.
menopause. I
Yeah.
don't know. And it's true. A lot of things
But it
are
shouldn't be
menopause,
overlooked,
but
right?
also
Because
menopause shouldn't be like a sentence of feeling bad for 10 years. Why should it? And
right.
it's just understudied and undertreated. And so
Well, most of medicine was made off of males, right?
exactly.
So
Yeah,
when you build the whole industry on males, of course, we're not gonna know much about the other, genders. So
exactly.
yeah.
Yeah. So there's just a lot. And also like until recently, it's been a really, I mean, my generation is probably the very first to even talk openly about
Mm-hmm.
it.
Right.
And then I think like slightly younger than me, there's starting to be more, trends and magazines and social accounts.
So
But I think that, so anyway, I just kind of kept asking questions basically. I don't know if my doctor put my symptoms into ChatGPT or if she asked, a
WebMD.
senior colleague or just talked about it at a dinner party. I don't know, but finally she came up with this theory. And then I
Mhm.
did tests for about 2 months, which was very tiresome. But I'm
Yeah.
glad in a way that I wasn't working because I had all this time to go back and forth to take all these tests.
Hmm.
I mean, that's part of it is like the management of it. The correspondence is in itself stressful. And then the stress itself triggers like symptoms and then you feel worse. So the
It
whole thing
just,
is just this kind of, yeah, loops on each
yeah.
other. So anyway, they finally diagnosed it, and it's a three. I think if I remember right, it's the 3.1 centimeters, 3.1 or 3.2.
Wow,
It's
that's
on my
big.
right adrenal gland. I also have gallstones, it turns out. So, which I've
Oh,
never had
okay.
before. Well, they're doing them both at once because the doctor will be quote unquote in the neighborhood, as she said. So
Hmm.
when I'm under, it's going to take in like another extra half hour to take out my gallbladder as well.
Okay.
And I'm just this in this holding pattern. So now I have a job. I'm actually working at I'm doing a contract gig at a healthcare company, which is awesome,
Oh,
but
cool.
I don't feel like working right now
Yeah, I
or
feel you.
doing anything except for like binge watching,
Hmm.
Downton Abbey, but I have to work. But I am now trying to figure out what my recovery time is going to look like, and no one can give me the same answer. I've heard 3 days, 3 weeks, 3 months. I'm like, I mean, I think also depends on what kind of job you have, right? I mean,
Hmm.
when you're back to an 8-hour day at a desk, doing computer stuff is different from being a teacher or
Running around or
doctor
something.
or
Yeah.
something. Yeah,
Yeah.
or a student.
Just more
So,
active role. So,
yeah. Yeah, but I mean, I
hmm,
have a dog and, life and everything. So with
yeah.
any luck,
There's
I
an
sh
outlet.
and there's pain meds, which is good, but they also make you a bit loopy. So
Yeah.
that's the basics of my story. So I guess my open questions aside from recovery, for like the people that I'm talking to are could that other that stress, anxiety, heart attack have, how long people the more I look into this, the more people say they have had it for longer than they thought. You
Yeah.
know,
Because it
some
doesn't
people,
really start kicking in until it's gone
right,
to a certain size.
which probably tracks with the size and the time. Like 3 years ago, when I was still living in Connecticut, I had a spell every once in a while, like,
Hmm.
I don't know, every couple weeks maybe, or
Right.
once a month. And up until I just got the alpha blocker recently to manage it before surgery, I was getting them like multiple times a day. And it's
Hmm.
like I can feel it in my body, like trying to get out. Do you know what I mean?
Yeah. 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 It's like fighting against it.
Yeah. I
Yeah,
can
that's
feel the
weird.
battle being waged between the medication and the
And
hormone.
like, is it a good way or a bad way though?
In a good way, I think, because
Yeah,
usually
because
the
you know
medication wins.
it's working. Yeah, that's
Yeah,
good
but
though.
it's just I think that I'm guessing I feel tired a lot, which it's true could just be a side effect of medication, but I also feel like I must be internally working hard too, you
Yeah,
know?
Maybe.
I
Yeah.
feel tired I feel, I'm also just so sick of it. Like the novelty is wearing off. Do you know what I mean?
Yeah. Yeah. It could also be even seasonal because I know in the winter I get depressed sometimes.
Yeah,
So
for
it
sure.
could be a bunch of factors factoring in, all at
And
once.
just, preparing for a surgery is always a big.
So you said that you started noticing symptoms about 3 years ago, you said,
Mhm.
yeah, around the COVID times ish. Before your diagnosis, which how long ago was your diagnosis again, by chance?
Um, let's see. I want to say maybe sometime in November.
Oh, okay. So that yeah, very recent. Very recent. Okay. Before you got diagnosed with possibly a pheochromocytoma, what did you think was going on inside your body? Did you think it was just like stress related, or like you said, you thought it was the COVID and just a bunch of things failing your
Yeah,
job?
I just thought it was uh like I've always had anxiety,
Mm-hmm.
and just
Yeah.
but it was just weird that it seemed like it would go from like 0 to 1,000
Yeah.
instead of it didn't seem to to correspond logically to the trigger,
Mm-hmm. Yeah, like
Um,
how epinephrine is normally supposed to act,
right. And
yeah.
it also still takes like it was taking forever to come back down from a spike.
Mm-hmm.
Like normal self-soothing things wouldn't work, like take a walk or go on a bike ride or,
Mm-hmm.
watch a movie or, I mean, honestly, like my doctors will not like they put their fingers in their ears if I say the word cannabis because they're just like they have to, even
It
though it's
causes
legal.
everything.
Like, it's like the only thing that works, and I'm supposed to be avoiding it before for surgery, but it's, too bad because it actually does work.
It's what helps, right?
It really does. So I hope
Mm-hmm.
that I hope that that the treatment can evolve, that if it is medically safe, that they can just be upfront about that because it's annoying to have to feel like I'm, you know,
Mm-hmm.
yeah, but it would be the only thing that worked. I mean, I have gabapentin, I had Klonopin, I had,
All these
um,
things, and it didn't really
things.
help until you
Didn't help.
tried cannabis.
Yeah,
Yeah.
exactly. I guess I just thought it was just general, the same anxiety,
Yeah.
maybe a touch of long COVID, just,
Mm-hmm.
getting used to a new place, but like hard job. But there was a kind of there there's the mental like paralysis,
Mm-hmm.
emotional um overload, and then there's the physical symptoms, which started getting more and more intense. So it started being like heart palpitations, my heart just racing.
Yeah.
Mm,
And then just stops suddenly. Yeah.
yeah. And then, or I would throw up sometimes because, I mean, I started learning how to lie down with my like legs over my head, and that would
Oh.
really make
Uh-huh.
it get better faster.
Mm-hmm.
But it would God, what are the other ones? I haven't memorized the 5 symptoms yet. But I don't know if I had pallor or not because I'm fairly pale as it is, but um I definitely I had faintness, I had sweating,
Mm-hmm.
I had headaches.
It's like basic anxiety sometimes. No wonder they
Yeah,
excused
but
it.
like they
Yeah.
would come on in a
In
spike, like
waves.
in a
Like
yeah,
really high
like a
waves.
tsunami of like,
Yeah.
and and yes, sometimes it would be from changing positions, but not always. Sometimes it would be
Mm-hmm.
as I was already standing up. So
Yeah.
I thought it was POTS for a little while because I have a friend who also had COVID at the
Mm-hmm.
same time as me, and she has POTS.
Yeah.
And
And it's similar. Blood
it's
pressure
similar.
changes. Yeah.
Yeah.
Extremely. Yeah.
Yeah. But I now they did when they finally did the scan, they saw the Pheo. So it was heartening to know. I made a little zine about my experience. I made a little
Mm-hmm.
collage zine, and I submitted it to an art show. So the opening is
Okay.
this Friday. It was really helpful for me to just like convey what it felt like, the
Mm-hmm.
frustration. Oh, I also have ADHD, so it's like, which was
Oh,
only
great. Another
diagnosed
thing.
like 2 years ago, or a year ago. So of course I was just like, oh, it's just me. I mean, and this is also a typical middle-aged woman thing, I think, is to be like, well, I'm just not a good enough person, or I just haven't
Mhm.
worked hard enough, or like tried hard enough, or have enough discipline, or have enough of I need a better schedule or workout plan or something. And like
Mhm.
there, you can always find reasons to blame yourself, and other people can find lots of reasons to blame you too. So
Yeah, right.
the answer is it's very vindicating. It's like there's
and
very
explains
few
it.
times at age 54 when you're like, I feel terrible all the time. And they're like, guess what? It's a thing and we're going to take it out and then you're
It's
going to
like,
feel better.
yay!
What? That's that never happens. So
Because it
that's
finally
great.
feels like it's not you and it's something that was out of your control. Yeah,
Exactly.
because
Yeah,
you got the
it's
baton back.
because there's a
Yeah,
lot, that life, life kind of like
throws at you.
has a cumulative effect. And so you
Hmm.
start kind of, and like just from a psychological perspective, we all tend to tell ourselves our story of who we are and what our life is.
Hmm.
And it's usually not fair or not accurate.
So you actually did mention earlier that you did testing for a couple months or a few months.
There were two CT scans and there were several 24-hour urine. um Cannabis showed work and caffeine showed in one of them, so I had to do it again.
Yeah.
And which, what else was there? Blood, lots of blood tests.
And when you were doing these tests, did you feel supported by your healthcare team? Like I noticed that you said that your doctor finally decided to try something. Up until that point, did you feel supported though?
Hmm, that's a good question.
Because it's kind of the double-edged
Not
sword,
really,
right? Yeah.
honestly. I mean, not really.
You felt relief, but it doesn't really
I mean,
mean that you felt
it's so funny because now
supported.
she's getting all the praise, like the
Mm.
surgeon was like, your primary care physician had made a like such a smart guess. And I was
For doing her job.
well, be after I nudged her 100 times.
Yeah.
But
Yeah.
yes, give her the props. But at the same time, um,
She could have done better.
yeah, it's just I don't know how our healthcare system could have I think maybe some more proactive. um I will give her credit that like when my blood pressure was really high, like last year, she nagged me once or
Hmm.
twice to say, "Hey, to come, don't forget to take your blood pressure."
Hmm.
So she kept on it. Um, I wish that she knew, I wish she were taking more ownership of the illness and like learning about it. I mean,
Yeah.
I wish that she
Studying medicine.
were saying, hey, I read this thing on I mean, even if it was just performative and even if just once she would like, oh, here's an article that
Hmm.
reminded me of your case. Like, I mean, I guess they have to be careful with recommending anything,
Because it's expensive. We're in America, you
but
know? Yeah.
also like, what if they recommended meditation, but then like I died and then they were like, oh, the doctor recommended medication. We're going to sue her for
Hmm.
malpractice. You know what I mean? I mean, sorry,
No,
meditation.
no,
That
no,
was a
you're
Freudian slip.
totally, you're right.
You
Because,
know what I mean? Like, I think there's certain things that,
hmm,
uh, honestly, I don't know if this is a Kaiser thing, but it's remarkable how often people don't answer um your questions, or they'll only answer some of them.
yeah,
And I
they
wish they
nitpick
could
kind of
just
whatever
be
they can answer.
forthright and just be like, here's the question that I could answer, or
Right.
whatever. Yeah.
Instead of just avoiding it.
Yeah, I just because then I have to ask again. And honestly, not to be like a complete complainer, but
No,
there
it's your life. You can advocate for your life,
I
you
know, but
know?
I've heard that there's a marking on medical charts for WW for whiny women or whiny white women, which fair, totally fair. But
Hmm.
at the same time,
It's your life.
when you have an endocrine, when you have either a psychiatric or a hormonal, you know, disorder, like stress is going to make it just makes it worse. And
Hmm.
repetition and feeling like a jerk and the whiner and a nag, like,
Hmm.
and feeling vulnerable, like, oh, they're going to think that I'm asking too many questions. Like, I have no idea. Here's the thing. I have no idea what the baseline of, I wish I would honestly rather have a weekly 10-minute call with my doctor than like
Hmm.
pepper her with a billion questions over messaging where who knows if she's even answering it half the time.
It could be our assistant or some random assistant, which it always is.
I guess I do want someone to dedicate their, And here's another little complaint, which is I'm sure you're gonna you read about and hear about a lot, which is I think Kaiser is actually fairly good as a healthcare system. However, I have a team right now, right? I have a psychiatrist who's managing my anxiety with medication,
Hmm.
sort of, not really. But working on it.
Trying.
She's trying. Uh, I have a surgeon, in at
Hmm.
Richmond Kaiser. I have an endocrinologist who I've never met, but she's the one who read my CT scans and diagnosed me in
Hmm.
Richmond. Then I have my GP. That's four people, and that doesn't even count the acupuncture,
Hmm.
clinic I've been going to, and I don't know, my friends and my family. Do you know what I mean? Like,
Yeah.
so none of these people can talk in one room at one time.
You have this
It's
care
just
system, but they're
not
not really your
allowed.
care system.
They're
Yeah.
just they're fragmented and they're just, you know, it's so it's asynchronous and no one can ask each other questions.
Hmm. If they did, they'd
But
probably find out about your condition way sooner, you know? And I feel like
I'm
part of
sure
being
that's
a
so
good
true.
doctor or just healthcare professional in general is you kept saying like you felt like a jerk asking questions. I feel like it's their job to ask you the questions, right?
I
You shouldn't have
thank
to go
you.
because you don't know what questions are right to ask. They have the whole textbook of the questions to ask you, the patient, you know?
You're
So I feel like
so
part of
right.
it.
They know, right? I don't even know what questions to ask.
Right. For POTS, for example, someone might like a regular patient might not know, but the right question is when you stand up, does your blood pressure get really high suddenly? Right.
Right.
That could be
Right.
for you, that could be for someone with POTS, you know, it just goes patient by patient, you know, but that's kind of the questions that I feel like they should take pride in asking, you know, not just viewing you as
Yeah.
another chart or as another number, but actually asking the questions to give you the right care and care about their job.
Another thing which has sort of been on my mind is I have no idea how serious this is. I mean, the there's a Facebook group, um, because I was poking around and I figured there would be a Facebook group, and there is. And everyone's
Hmm.
like, "What did you name your Theo?" I named mine Theo, and or like Little
Naming it.
Tinker, and that's great. And I get
That's
it. People
weird.
have to make jokes about stuff, but at the same time, it's like, I think people are just getting through it with community and humor and everything. But
It's becoming a sense of normalization, though. You're normalizing it.
exactly, like I just don't know. And then sometimes I feel like I'm being melodramatic if I say this is a rare tumor, and if they don't catch it, it can be fatal. I mean, and the surgery itself is high risk.
Hmm.
And yet I find that my own family members are not they're I mean, they're not very good at, emoting anyway, but
Yeah.
I have no idea if they understand the seriousness of it.
Yeah. I don't, because unfortunately people aren't educated enough on it because, you know, it is a rare. Well, I don't think it's rare in itself. I think it's just so rarely diagnosed.
Right.
You
Yeah.
know, because before you knew what it was, you thought it was just anxiety and getting a new job and just all those other stress factors adding up. Whereas it could be the case for a lot of other people to where they think it's those things happening, but in reality they have a pheochromocytoma, you know.
Right.
And I think that it just sucks with the how our healthcare system is built where people aren't being diagnosed properly, you know.
Yeah. No, thanks. So that's good.
And
Thanks for the
hopefully it
affirmation.
gets better.
Good,
Hopefully,
thank
fingers
you.
crossed. Hopefully
Well,
it gets
oh,
better.
that's the other thing is that I was so excited that it was gonna all go away and I was gonna be a different person, and then now I'm running into cases where people are like, "Oh, I still have all the same symptoms," or "It came back," and I'm like, "I hope those are the less common instances."